Generalized anxiety disorder, GAD, is a specific type of anxiety disorder. Most people worry at times about their health, job, money, or family, but people with GAD experience anxiety about these things and more in a way that is persistent, excessive, and intrusive. Often, people with GAD struggle to relax and have trouble concentrating on tasks. They may experience physical symptoms including restlessness, sweating, difficulty swallowing, and using the restroom a lot. According to mental health experts, nearly 3% of all U.S. adults have experienced GAD in the last year, and it is estimated that up to 9% experience GAD at some point in their lives. But with proper treatment, including medication and psychotherapy, they can learn to manage their symptoms and live a more productive life. Generalized anxiety disorder, GAD, can be a challenge to diagnose. People consider panic attacks a hallmark of all anxiety disorders, but GAD is different in that there are generally no panic attacks associated with the condition. As a result of this misconception, without the experience of panic attacks, a person may think they are just worrying too much. Their struggles with constant worry may be minimized or dismissed and, in turn, not properly diagnosed or treated. Most of us experience worry in situations that can cause us to feel anxious. So what are professionals looking for to help determine if someone's worry and anxiety are related to GAD? An evaluation of symptom criteria, as outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as the DSM-5, is the first step. Mental health professionals look for factors like excessive, hindering worry paired with a variety of physical symptoms, then use proven diagnostic assessments to make a diagnosis and rule out other possibilities. Symptoms. The DSM-5 outlines specific criteria to help professionals diagnose generalized anxiety disorder. Having a standard set of symptoms to reference when assessing clients helps them to more accurately diagnose mental health concerns and, in turn, create a more effective plan of care. Criteria for diagnosing GAD. When assessing for GAD, clinical professionals are looking for the following: the presence of excessive anxiety and worry about a variety of topics, events, or activities. Worry occurs more often than not for at least 6 months and is clearly excessive. The worry is experienced as very challenging to control. The worry in both adults and children may easily shift from one topic to another. The anxiety and worry are accompanied by at least 3 of the following physical or cognitive symptoms. In children, only one of these symptoms is necessary for a diagnosis of GAD. Edginess or restlessness. Tiring easily, more fatigue than usual. Impaired concentration or feeling as though the mind goes blank. Irritability, which may or may not be observable to others. Increased muscle aches or soreness. Difficulty sleeping, due to trouble falling asleep or staying asleep, restlessness at night, or unsatisfying sleep. Excessive worry means worrying even when there is no specific threat present or in a manner that is disproportionate to the actual risk. Someone struggling with GAD experiences a high percentage of their waking hours worrying about something. The worry may be accompanied by reassurance seeking from others. In adults, the worry can be about job responsibilities or performance, one's own health, or the health of family members, financial matters, and other everyday, typical life circumstances. In children, the worry is more likely to be about their abilities or the quality of their performance, for example, in school. Many people with GAD also experience symptoms such as sweating, nausea, or diarrhea. The anxiety, worry, and other associated symptoms make it hard to carry out day-to-day activities and responsibilities. They may cause problems in relationships, at work, or in other important areas of life. In order to give a diagnosis of GAD, these symptoms also must be unrelated to any other medical conditions and cannot be explained by a different mental disorder or by the effect of substance use, including prescription medication, alcohol, or recreational drugs. Assessment. During an assessment, your clinician will use the diagnostic criteria, standardized assessments, and their clinical judgment to make a diagnosis. Generally, they will ask about your symptoms in an open-ended way, but you may also be asked to complete self-report questionnaires. These typically brief measures can help determine the diagnosis, as the Generalized Anxiety Disorder Scale 7 does, or severity of symptoms. In specialized care settings, like an anxiety disorders clinic, standardized assessment tools are sometimes used to evaluate symptoms. In this case, your clinician conducts a semi-structured interview. The interview is likely to include a standardized set of questions, and your answers will help your clinician to make an accurate diagnosis. Commonly used and well-validated diagnostic interviews for adults include the structured clinical interview for DSM disorders, SCID, and the anxiety and related disorders interview schedule for DSM-5, ADIS-5. There is a child version of the ADIS, in which both the parent and the child are asked about the child's symptoms. These interviews also evaluate the presence of other associated conditions such as depression. GAD is a treatable condition. There is no need for you or your child to worry in silence. Treatment, particularly psychotherapy, self-help approaches, or other therapies, will teach you a variety of ways to cope with your anxiety. There are also medications that can help.